Okay, so we will be going through FMS testing for shoulder mobility. And so the purpose of this is going to assess bilateral shoulder range of motion, combining internal rotation with adduction and extension, and external rotation with abduction and flexion. And it also requires normal scapular mobility and thoracic spine extension. And so the tester first determines the hand length by measuring the distance from the distal wrist crease to the tip of the third digit, and the individual begins standing with feet together and remains in this position throughout the test. The individual is instructed to make a fist with each hand, placing the thumb inside the first fist. They are then asked to assume a maximally adducted, extended, and internally rotated position with one shoulder and a maximally abducted, flexed, and externally rotated position with the other. During the test, the hands should remain in a fist and they should be placed on the back in one smooth motion. The tester then measures the distance between the two closest bony prominences and performs the shoulder mobility test as many times as 3 times bilaterally.
So for tips for the testing, the flex shoulder identifies the side being scored. If the hand measurement is exactly the same as the distance between the 2 points, then you score it low. The clearing test overrides the score on the rest of the test, and make sure that the individual does not try to walk the hands towards each other. So when you're scoring this, for a 3 on the score, the fists are within 1 hand length apart from each other. For a 2, the fists are within 1.5 hand lengths, and for a 1, the fists are not within 1.5 hand lengths from each other. So then at the end of doing all of that, you would do the clearing exam. So this is done at the end of shoulder mobility test. The movement is not scored, it is simply performed to observe a pain response. If the pain is produced, a positive is recorded and a score of 0 is given to the entire shoulder mobility test. This clearing exam is necessary because shoulder impingement can sometimes go undetected by shoulder mobility testing alone. So with possible reasons for limitations.
So some possible reasons could be, the most common one is probably going to be that internal rotation is limited. You could also have a lack of thoracic extension, scapular thoracic immobility, or possibly some pec tightness. So some exercises that you could do could be a pec stretch against a wall, kind of like that. And then you could do manipulation to help the thoracic extension. And if it is due to a lack of internal rotation, you could also do, well, that'd be for patients that probably have excessive external rotation, limited internal rotation, like overhead athletes. And you could do anterior posterior shoulder mobilizations in order to increase the internal rotation.